Welcome to the Mental Health in Schools virtual learning series from the Virginia Department of Education's Office of Student Services. My name is Sarah Bazemore, and I am the School Counseling Specialist and Student Assistance Systems Coordinator at the VDOE. All of the virtual learning opportunities found within this series were hand-selected to support school leaders and school-based mental health practitioners as they prepare to respond to the mental health needs of their students. Presentations are organized into 4 strands: equity, recovery, virtual supports, and trauma. You are currently viewing a module from the virtual supports strand. Our presenter today is Mr. Benjamin Fernandez. Benjamin completed his graduate studies in school psychology at Bucknell University in Pennsylvania, and he has worked as a school psychologist in Pennsylvania and Virginia with over 23 years of experience as a practitioner. Currently, he works as a lead school psychologist in Northern Virginia, providing leadership to school psychologists in a broad array of psychological and school-based mental health services, including assessment, consultation, counseling, prevention, and intervention. In addition to these duties, he is a Prepare WS1 and WS2 master trainer and is responsible for training school-employed mental health staff for his district. He serves as a crisis team leader and assists with the implementation of crisis intervention services by maintaining and updating the crisis team operations plans, response consultation, and leadership. Additionally, he has contributed to the presentations, articles, books, presentations, and webinars related to youth suicide, prepare, and school safety and crisis on the local, state, and national levels. He has testified before the Senate Committee on Health, Education, Labor, and Pensions, the Federal Commission on School Safety, the Congressional School Safety Caucus, and served as a member of the Governor of Virginia's Children's Cabinet on Student Safety. Most recently, Mr. Fernandez contributed to the Virginia Department of Education's Suicide Prevention Guidelines. In 2010, he was named School Psychologist of the Year by the Virginia Academy of School Psychologists, and in 2012, he was named School Psychologist of the Year by the National Association of School Psychologists. And I can personally say that I have had the opportunity of collaborating with Ben on a number of projects, and he is always so enlightening and keeps students at the center of all that he does. So I am beyond thrilled to be able to bring him to you all virtually so that we can glean from his wisdom as we all sort of think about how we are going to and like I had the wrong title there, I'm sorry, Ben, but how we're going to address suicide on a virtual basis, as we all kind of step into this new landscape. So without further ado, I'm going to hand the virtual floor over to Ben so that we can hear from him.
Thank you, Sarah.
You.
Right, so let me get this set up. Is my screen up, Sarah?
It is. It looks great.
Okay, great. Thanks everyone for joining me today as we talk about suicide prevention considerations in the virtual environment. There we go. Sarah already did the introduction about me. Here's some contact information if you have any questions afterward. But I'd like to start by talking about our objectives today. I'd like to talk about, in our presentation today in our discussion, we're going to identify the protective factors, the risk factors, the warning signs of suicidal ideation and behavior in children, as a look in the traditional in-person environment, as well as have some conversation of what they might look like also in the virtual environment and how COVID-19 may have impacted some of the factors associated with that. We're going to talk about elements of suicide prevention in the traditional as well as virtual environment or settings, and we're going to talk about ways to improve your school's prevention efforts, again, also in the traditional in-person and virtual distance learning environment. So what this webinar is not, it's not a replacement or a substitute for comprehensive suicide prevention programming. Comprehensive suicide prevention programming includes suicide prevention, intervention, and postvention procedures. So if you're looking for more information on comprehensive suicide prevention, take a look at the Virginia Department of Education's suicide prevention resources pages. And I have it linked here with a QR code and link, but I also have it included in the resources at the end of my presentation today. So I want to start off with a quick overview of where we are today with youth suicide. And I'm going to start by talking about data from the Youth Risk Behavior Survey. The most current data as of today is from 2017. They're supposed to be releasing new information this month, and I was really hoping to catch that for this information, or for this presentation, but unfortunately it wasn't available. But people look out for it the rest of this month. So if you look at the data being presented, starting in roughly 2009, you could see an uptick with feelings of sadness and hopelessness, thoughts about suicide, plans for suicide, attempts for suicide, and attempts that required medical attention. You can see that ticking up all the way until about 2017, where they all started to tick down, with the exception of feelings of sadness and hopelessness. And when you think about that, that's obviously related to depression. So that's something that we need to be aware of. What's going to be very interesting now is to see the data in the next few years on how COVID-19 and this pandemic situation that we're in has impacted this data. There's a lot of moving parts in terms of influences to the risk factors and warning signs. And since we're kind of in the middle of it, it's kind of hard to truly see what's going on. But in the future, it's going to be interesting to see how that has influenced these things. Regardless, the point is that youth mental health and youth suicide behaviors are a concern that we absolutely have to address. Some additional data from the Centers of Disease Control, suicide, youth suicide, continues to be the second leading cause of death for students between the ages of 5 and 19. And those who have died by suicide have struggled with a mental illness, typically depression. And I wanted to talk about this data, again, to emphasize the importance of the work that we're engaged in. And to also emphasize that it's not a hopeless fight. Suicide is preventable, and there are many ways that we can engage and help folks get the help, treatment, and support that they need. And part of that includes utilizing a comprehensive suicide prevention program that promotes hope, help, treatment, and recovery. So let's start off by having an understanding about risk factors. And risk factors are the factors that create the potential for suicidal behaviors. You can break suicidal behaviors down into 4 broad categories: social, personal, familial, and historical. And you can see from the screen here that you can break those down into those areas. Socially, we're looking at students, that may have difficulties with bullying, social isolation, and relationships, things like that. Personal, there could be a history of illness, trauma. Familial, we're looking at potential issues associated with abuse, mental illness within the home, lack of access to care, things like that. And historical risk factors, previous suicide attempts, history of non-suicidal self-injury, those kind of things. I want to stress that suicidality is not a simple formula. It's not A plus B equals suicidal behavior. There are a lot of moving parts. There are a lot of risk factors and warning signs that we need to understand and be able to connect the dots to provide support for students. But it's good to have that foundational understanding of what we're dealing with. Now, looking at risk factors in the context of COVID-19, I think it's safe to say if there were problems at home before COVID, that they're likely to be amplified now that we're in the middle of this pandemic. And again, thinking about the broad categories of risk factors, students who, on a personal level, they have a history of mental health that potentially could be amplified, but there also could be subclinical issues that prior to COVID, they were doing okay, but now with the particular stressors that are associated with COVID-19 and the closures that may have been amplified those things. Additionally, students are not connected to peers like they were 6 months ago, 7 months ago, when they were able to do face-to-face interactions at school. They were able to connect with trusted adults and be able to connect with safe and supportive school environments that they once had in school. And additionally, families are experiencing significant stressors as a result of the pandemic. Some being with job loss and economic impacts and security. They could be experiencing deaths and grief. And I would venture to say that some of the issues associated with grief and loss during this time is complicated. It may not necessarily be that typical grief that folks are experiencing, simply because of the issues around physical distancing and contagion and COVID mitigation strategies are preventing the typical grief process that we've seen in the past. Now, in terms of warning signs are those red flags that someone is thinking about suicide and that intervention is needed. And you can see this is not a comprehensive list, but there are direct warning signs where it's pretty clear what the intent of the student is doing, and there may be indirect, more kind of covert, they're very vague kind of statements about what they're doing. So it's important to understand that both of those exist and how we may need to navigate those if we see them in students. And then lastly, it's important to discuss protective factors. And protective factors are those factors that help reduce the likelihood of suicidal behavior. And if we look on the screen here, schools play a huge role in protective factors with students, whether it's in person or in the virtual environment. In both settings, we can provide that effective access to mental health care and supports and connect them onto community resources. And we can establish a sense of connectedness and community within our schools, as well as teaching resilience, coping, and strengths. So schools play a large role in those elements with our students. So in terms of preparing for your suicide prevention initiatives, there's a few things that we need to consider. First, that youth suicide and suicide prevention is 24 hours a day, 7 days a week kind of thing. However, schools are not. We have certain hours that we work where we do provide access, and schools are a large access point for mental health supports for students. So the question is then, how are we going to address suicide prevention after hours? What are the protocols? What are the procedures? What are the plans? And do we have those in place? So those are some elements that we need to be considering. Related to that is, who are we going to collaborate with in our community? Those, in terms of suicide prevention being a 24/7 thing, our community partners are working after schools are closed, and how can we connect them and work with them to make sure that there is a continuing of support for students. Additionally, we want to make sure that everything we do for students, whether it's our prevention work or intervention work or whatnot, we look at that work through the lens of equity, with an equity lens. In terms of prevention, we want to make sure we ask the question, are we truly able to reach our students and our families? Is there a language barrier? Is there a cultural barrier? Is there a technology barrier? What are those things that will get in the way of us being able to access and support our students? Next is communication methods, making sure we understand the technology we have at our fingertips, and how we are able to push out prevention messages, and are there ways for families, students, and teachers to reach back to us to get some help? And then lastly, do we have actual suicide prevention policies and procedures in place? And so those are some key things that we need to consider. Okay. Slide is stuck here for a second. Oh, here we go. Sorry about that. Now, as we transition from the brick and mortar in-person environment or suicide prevention to the virtual suicide prevention, we must make sure that we are looking at things through another lens of doing no harm. This is particularly important because in the virtual environment, we do not have the safety nets or mechanisms that we had when we're in the physical environment. So again, it starts with looking at our current policies and procedures and saying, how can we adapt them to the virtual environment? And again, looking at those policies and procedures to say, how can we make sure we're not doing harm? We don't necessarily have to recreate the wheel, but we need to adapt very carefully. I'll talk a little bit more about these challenges shortly, but it's something to start that thought process about. The next is making sure that we have mental health staff and those collaborative partners available, and have they had the opportunity to get together to meet and plan how they're going to push out suicide prevention, education, and other services. Again, looking at the technology, do we have approved accessible technology to help communicate with families, that families can reach back out? Messaging, as well as webinars for parents and teachers. Again, using that lens of equity to make sure that we're reaching everyone we need to. And then another consideration are our permission forms. Making sure that when we do our suicide prevention education, that caregivers have an understanding of what that education is about. What kinds of information their student or their child is getting, what is their role in during the prevention lessons, the contact information if we need to get in contact with them, those kinds of things. I would encourage a more active kind of permission form where the caregiver indicates, yes, I want my child to participate, where you can collect that contact information, like I said, to make sure we get in touch with them. And then another element that we have to have in place is our intervention procedures as we move forward with our prevention education. Now, just to talk a little bit about some of the challenges in the virtual or distance learning environment. Again, we don't have those safety mechanisms or nets that we once had in the brick and mortar. We don't have that face-to-face access to our mental health teams or mental health staff. We don't have the supervision of students to keep them safe, and we don't have some of those other elements. But the first thing we need to be aware of is safe messaging. Now that students and kids are home, they have more access to messages that may be inappropriate and dangerous in terms of imagery and messages about mental health and about suicide. So that's something that we really need to be aware of. The other thing we need to be aware of, whether when we're doing any kind of work with students related to suicide, whether it's prevention, intervention, or post-prevention, is their location. Where are they? Are they home? If they're home, where exactly are they? Are they in their bedroom? Are they in the basement? Are they family? Where are they? In case we need to intervene and get them some help. Other things to ask: are they home by themselves? Or is there a parent there that can, or an adult, or other caregiver that can help? And what's the environment like? Other things we need to consider again are the accessibility. Technology can be unreliable and can pose a challenge. And making sure we have that in place, and also understanding the limits of confidentiality and privacy as we go forward. So some key elements related to suicide prevention, involve, starting with positive messaging. We don't want the message to be overshadowed by the risk factors, by the warning signs, and presenting this image, this picture of doom and gloom and hopelessness. We don't want that. We want a message that changes the narrative to hope, help, treatment, recovery, and strength. That's the message that we want to make sure we're pushing out. And through our suicide prevention efforts, whether it's direct instruction or how we're doing it through our SEL work or advisory work in our schools, that's the kind of thing we want to be pushing out in our messaging. Excuse me. Another thing in terms that we want to make sure that we're emphasizing is social connection. Even though we can't have that face-to-face in person, we want to make sure that they understand that there's connection in other ways that we can provide through schools. We want to provide information that educates families and teachers and empowers them to know how to recognize these warning signs and engage their student and child, and how to seek help and how to get help. We want to educate and provide information about mental wellness, about means restriction, how to help and how to seek help locally and through hotlines and text lines. And ultimately, we want to make sure our focus is, like I said, promoting that wellness, that mental wellness and strength to build resiliency. So when we are doing some direct suicide prevention education, we're going to be focusing on 4 groups. The first being caregivers, the next being students, teachers and other staff, and then finally specialized, the mental health staff. So with caregivers, the training goal is to make sure they understand the myths and the facts about mental health and suicide, as well as to help them recognize some of the warning signs for their students. At the same time, we want to emphasize the protective factor role, or their role in the protective factors, such as social connections within the family, access to medical and mental health, and emphasizing strength and coping. And adults can really, and caregivers can really help promote that within their home settings. Another thing for parents is, for many, they will want to know what to do when confronted with suicidal behavior and how to seek help. It's important they understand how to get help during the day and after school hours, and they also would be helpful for them to understand what they should expect, if there's a significant concern and we need to respond to it in the virtual environment. And then another key thing that would be helpful for parents is to have a conversation with social media and the potential dangers of negative messaging that their students and children may be exposed to. The next group is students, and I think this area in particular will require a great deal of planning and consideration because of the issue of not having the in-person safety mechanisms and safety nets that we did have in the physical, in-person school setting, and now that we lack those things in the virtual setting. The goal again is do no harm. Strong consideration and planning needs to be done in how your school will approach educating students in this area. However your school district decides to educate your students, I think it's important that if you're going to do some direct instruction, to really consider having 2 facilitators. If you're going to do specific lessons on that, have one of the facilitators teaching the content, the other monitoring the chat and videos. Considerations may include having smaller groups if you're going to do that. Set expectations that the cameras will be on so we can monitor student reactions. Again, having the expectation of knowing exactly where the student is in the house and the available parents. And then having contingency plans available for scenarios where that involve, not having the parent available. What happens when a student becomes upset? How are we going to address those specific concerns? So those kinds of things are going to be very, very important. The other thing that we want to consider is in the content that we're delivering, it is hope-based. Well, it's a hope-based and a wellness approach. Again, we want to steer away from the doom and gloom of just solely risk factors and warning signs, but we want to have that emphasis and focus on the mental wellness and hope. There does need to be some understanding of what those warning signs and when to seek help, who to seek help from. So it's important that but despite that, we still have to have that hope, help, recovery, and treatment message. And I think in terms of suicide prevention with students, it's not just this educational piece. It's a lot of that upstream prevention, the SEL work, the work we're doing with advisory. So there's many different approaches to delivering that content to them. Next is teachers and other educators, and like the training we do for the caregivers. The goal is to help teachers understand the myths and the facts as it relates to mental health and suicide. You know, one of the challenges will be, you know, what's concerning behavior in a virtual environment. You know, having a conversation with teachers ahead of time, getting their observations from any of the distance learning they did in the spring could be very helpful to set kind of like a baseline of what is expected behavior and what is not. And so just engaging that conversation, but also communicating and teaching them what those typical warning signs might be. Um, and also another consideration might be, you know, that expectation during advisory time, if the school has it, that the camera's on. So at some point, some adults can actually see students and things like that. And ultimately communicating that if a teacher has a concern, no matter how small, it does not hurt to reach out to the mental health professionals in your school. Err on the side of caution and seek help when something is triggering or is observed, I should say. The other thing to emphasize again is who teachers can reach out to if they have concerns, both during the school day as well as after hours. You know, we've all had experiences where teachers receive an email from students after hours indicating some things and they need to respond to it. Making sure that teachers and other educators know what to do if something like that happens after hours. And then the last group are the specialized staff, the mental health teams, making sure they're fluent in their how to conduct suicide risk assessments. If they have an understanding of crisis response and post-vention work, they have an understanding of telemental health or telehealth work, as well as having supports for self-care and understanding self-care. They're going to be potentially taking the brunt of the suicide screenings and, you know, possibly responding to crises, and that certainly can take its toll. So making sure those elements are there to address things for them. Now, as I wrap up, I want to leave you with some suicide prevention lifeline information that's in English and Spanish, as well as the crisis text line. This can certainly be part of your messaging campaigns, and it's just good information to have. You know, I believe that school safety is an all-school responsibility where everyone helps to create a safe and supportive school environment where all can thrive. And suicide prevention is a part of that effort. And the work that we will be doing for our students and our communities will help them to thrive. So I really want to thank you for joining me today. And I encourage you to take a look at the other presentation that's available, the suicide intervention considerations in a virtual environment. And if you have any questions, feel free to reach out. And I just want to wish you all the best at this coming school year. So thank you very much for joining me and hope to see you in the next presentation.